2-month-old Caucasian male presents to the clinic today for his 2-month well visit. Mom denies any illness or developmental related concerns. He was born via spontaneous vaginal delivery on 9 July 2015 at 13:30 to a 26-year-old G1, now P1, mother at 36 weeks gestation, which was confirmed by ultrasound. He weighed 3,010 grams. He had a 1-week NICU admission for feeding difficulties. Additionally, during this admission, he was treated for hyperbilirubinemia with phototherapy for 48 hours. Mom reports an uncomplicated pregnancy, and her 36-week delivery and labor was initiated by a spontaneous rupture of membranes. This was a planned pregnancy with prenatal care initiated at 8 weeks. Her gestation was without illness. She was GBS positive and treated with 2 doses and greater than 4 hours of antibiotics prior to delivery. Mom reports a well-balanced diet during pregnancy and denies any hyperemesis. She consumed 2 Flintstone vitamins daily before and during pregnancy. She had no concerns for substance use or abuse during her pregnancy. Her labs were normal. She was hepatitis B immune. Her CBC was normal, syphilis immune, HIV negative. She had a normal glucose tolerance test. She was GBS positive, and then she was GC negative. Her quad screen was negative as well, and then her blood type was A positive, and she had an ultrasound completed at both 12 and 20 weeks. There was no fetal distress during pregnancy, and mom was negative for preeclampsia. She had the spontaneous rupture of membranes followed by 10 hours of labor. She had clear fluids. She had a spinal epidural performed at 4 hours after delivery. There were no prolonged periods during the labor. Baby was a head presentation, received 2 minutes of blow-by oxygen during delivery. Mom reports a great birth experience. Mom and the father were present at the delivery. Baby's Apgars were 7 and 8. At the 1 minute, he lost 2 for color. He was 0 for color, 1 for tone. At 5 minutes, he was 1 for color, 1 for tone. No known allergies for baby, no accidents or illnesses, no operations. He did have that NICU stay where he received gavage feedings for 2 days, then he weaned to the bottle and then to the breast. He was discharged home to the mother and the father. He did not have any difficulties with apneas or bradycardias, and he did not have any trouble maintaining his temperature. For development, baby coos when he is spoken to. Starting yesterday, he started smiling at faces, and he bats at toys. He is wearing cloth diapers. He had a hepatitis B vaccination administered at birth. And then his newborn screen was normal, and he had an audiogram before discharge from the NICU, which was also normal. Family history: mom is age 26 with no chronic illnesses or known illnesses. Father is age 27. He was treated for ADHD as a child, starting at age 8 through ages 18. He has not taken any medication since high school and no other chronic illnesses. Maternal grandmother is age 57, and she has been diagnosed with hypertension and obesity. Her hypertension was diagnosed in her 50s. And then maternal grandfather is age 59 with the same hypertension and obesity diagnosed in his 50s. Paternal grandmother is deceased. She died in a car accident at age 40 with no known chronic illnesses. And then dad is not in contact with the paternal grandfather. No other concerns for chronic illnesses for the family. Baby lives with mom and dad who are married. Mom is an ICU nurse. She works at a local hospital. Father works in an office for a food chain. Their home is a rural dwelling. It was built in 2000. They have well water. They are not aware of the last time it was tested. Parents do not smoke. Maternal grandmother provides the care for the child when mom is at work, and she does smoke, but she smokes outside of the home, and then she washes her hands before touching the infant. They have no concerns with finances, and they're covered by Blue Cross Blue Shield insurance. Mom says initially it was difficult adjusting to baby's sleep schedule, but she utilized her mother and the father for support, and she feels that now they've settled into a routine and they have a strong and happy marriage. She denies any concerns for depression. Baby is breastfed, feeding every 2 to 3 hours with 1 4-hour break at night. When breast milk is expressed, he consumes approximately 5 ounces. He has yellow soft CD stools approximately 4 times a day, a wet diaper every 2 to 3 hours with pale yellow to clear urine. He has a play mat, and he's starting to bat at toys, and he kicks his legs. Mom is starting to do some tummy time. He sleeps in his crib on his back. He self-soothes, and he sleeps approximately 16 hours a day. Mom reports that he's an easy baby, that he sticks to a routine, that he sleeps in his crib, he cries to eat, and he calms when he is held or when he's fed. And then he has had 2 follow-up visits after being discharged from the NICU and had gained weight at both of those visits. He had a newborn rash for the first 2 weeks of life, which is self-resolved. Mom doesn't have any concerns about his skin now. He does look to faces when the parents come near. Mom's not concerned about his eyes. She denies any nasal congestion. He does coo when he's spoken to. No noted teeth. And Mom reports no difficulty with breastfeeding, no cyanosis or sweating with feedings. Baby had a circumcision completed on day of life 6. Mom says it is healed well. And he's using both sides of his body equally, batting at toys equally with both hands, and then kicking his legs with both legs.